This is my dad, Jack Pinkerton, at his home away from home, his hunting camp.
It's nice and quiet in the mountains, and I have a lot of work to do up there.
This is what my dad means when he says work. At 87 years old, he still chops up wood.
I had some trees cut down a few years back, and I'm cutting up the limbs and dead trees there. So it gets me pretty busy.
My dad had to put the chainsaw down when doctors spotted something incidentally on a scan, a tumor in his bladder.
Of course, it's quite a shock. So I thought to myself, now, what am I going to do?
The bladder cancer team at Penn State Cancer Institute had the answers.
When your dad was first diagnosed, my former partner took him to the operating room and did an endoscopic procedure to remove the tumor. That was successful. The tumor was removed in its entirety, and it was found to be an early stage. It had not invaded at all, but it was high grade, meaning it had the potential to be a bad actor if it was left alone.
Immunotherapy would have been the next step, but because of my dad's medical history, the decision was made to monitor him.
He was put on a surveillance pattern where a cystoscopy was performed every 3 months, and that allowed him to do well and without a recurrence for almost 2 years.
Until one day, the cystoscopy found another tumor. Last year on Halloween, my dad was at Penn State Health where Dr. Kaag removed the tumor.
Well, I didn't go trick-or-treating, of course, but with my meal, they brought me up some trick-or-treat candy.
So the most recent trip to the operating room we felt was again successful. We thought we had removed all the tumor, but now with a second high-grade recurrence, I felt that he really needed to receive further therapy.
Further treatment came about through new developments in chemotherapy.
And so we chose a chemotherapy alternative that did not require the body's immune system to be involved, and we were able to deliver that for him. So we set him up for once-a-week treatments where he came into the clinic, a small catheter was placed in the bladder, and 2 different chemotherapy drugs were delivered in sequence. And he was asked to hold those in his bladder for a certain period of time before he was then allowed to go home.
It took about maybe 3 hours, and sometimes I just fall asleep. So nothing to it.
Family, friends, and his faith have helped my dad through this unexpected diagnosis.
People were praying for me, and I just feel like the Lord has taken me under his wing, that I don't have any pain or anything like that.
But he's doing really well, actually. His last cystoscopy looked clean. He seems to be bouncing back really well. And the last time I saw him, he seemed like he was in good spirits and maintaining a good level of activity. You can probably say better than I can whether his quality of life is good, but I've been really impressed with how he's done, and he seems to be cancer-free at the moment.
Cancer-free, 2 words we all embrace.
I felt great, and I was really happy that it was gone.
Now my dad is ready to move on to his next project for this summer.
Always have painting to do. Last summer I painted the porch, the floor, and the wood around the banister and everything. And it has 33 windows in it, so there's always a lot of painting there.
Living life to the fullest. My dad can't thank the team enough at Penn State Health for their care.
It's been great. I mean, they seem as though at Penn State Health that they can't do enough for you. And I really appreciate what they do.
My dad said he had 2 options when given this diagnosis: sit around and do nothing, or keep active. And as you can see, he chose the latter. And joining us right now is Dr. Matthew Kaag, Chief of the Division of Urologic Oncology at Penn State Health, and my dad's doctor. What a journey it has been. We are so appreciative of your care and the team's care for my dad.
It's my pleasure. We love doing this.
And you certainly do a great job of it. Why don't you talk to us about the quality of life after a cancer diagnosis? Really, that is so important.
So particularly in bladder cancer, it's important because a lot of our patients live a long time. 2/3 of patients that come into my office present like your dad did, where we can maintain the bladder in place, get them through treatment, and they get back to a normal, healthy lifestyle. And we want them to have that as quickly as possible.
Yeah, and certainly makes a difference.